at that point, the eye will never see well. So thankfully, the screening that gets done in schools usually picks this up. And what you can do to correct this is you put the glasses as needed, and then you actually patch the better eye. You put a little patch over the good eye to force the bad eye to work harder and harder, and that corrects itself very easily, but you have to catch it.
You sort of zoomed into what I was going to say, because I was going to ask about the patch, because I hear people say sometimes, oh, they put a patch on the eye to help the other eye, because it's the weaker eye. I think that's how they say it, the weaker eye and the stronger eye. So thank you for that. Now, how about teenagers, adults, and the elderly?
Sure. Teenagers do a lot of sports, so trauma is a big thing in teenagers. So you worry about sports, you worry about golf, you worry about baseball bats, you worry about BB guns, sometimes drilling and hammering. These are all things we recommend wearing protective eyewear. We see a lot of cases where things go wrong and the eye something hits the eye and causes problems. So be very, very cognizant of the need for protective eyewear. Another thing that teenagers do is they often buy contact lenses that have colors in them to change the color of their eye. Unfortunately, many teenagers buy them off the street, not from a professional. So they don't realize that you must clean your contact lenses every night. This goes for colored contact lenses as well as the regular ones for prescription. Clean them every night and take them out of your eye and disinfect them. Do not sleep with your contact lenses on, because the minute you sleep with your contact lenses on, that's a great environment for germs to develop, and germs will start actually eating away at your eye. So always take your contact lens off every night.
So what I hear you saying is we should never buy contact lenses just from any old body off the street. Now, what about the contact lens that you see advertised on TV and they say the packages are cheap or inexpensive? What about those?
Right. So contact lenses advertised on TV are fine as long as you get them from a professional, an optometrist or an ophthalmologist, who can train you on taking care of them. So even when a contact lens says, good to sleep in for a month, there are a number of brands that do that. Do not do it. Take them out every night.
So the key for contacts, if we're going to do contacts, keep them clean, don't sleep in them. That goes for adults as well as
Anybody
children.
who wears contact lenses,
okay,
that's right.
Thank you. How is a person's visual health affected by our general health? What are some of the symptoms that we can start to look for?
Sure. And this is especially for the elderly. Let me also talk about middle-aged people in general before we get to that. Middle-aged people, if you, by the time you hit 40 or so, you'll start needing reading glasses, and that's when people wear bifocals or different kinds of glasses that are basically bifocals in different forms. Now, the elderly are the ones who really have to worry about chronic diseases like diabetes or high blood pressure. And the eye, as you saw in the model, is the only organ in the body where you can actually see into the body. So I can see the blood vessels and what they look like. And diabetes and high blood pressure especially really can do harm to the blood vessels. So as you worry about your health, you want to make sure if you have diabetes or high blood pressure to go to the eye doctor at least once a year to check and see how those blood vessels are doing, because they can leak, they can grow in weird ways. And if we catch it early, we can prevent a lot of problems. If people wait too long, then you're really putting a lot of burden on your eyes, and maybe the disease will progress very far. So we want to avoid that.
So especially if you have health problems such as high blood pressure, diabetes, things of that sort, you should be very, very careful to get your eyes checked once a year or more if possible,
Yes.
or if you need it. I should say if you need it.
Yeah, definitely once a year. If we see any problems, then we'll say probably twice a year or 3 times a year. But usually for most people, we check once a year. And at the same time, they'll also check for glaucoma, which I spoke about, which is high pressure in the eye. That's something to worry about as well, especially if it runs in your family. So you want to get someone to check that, and that can only be done by a professional. And they'll also check for cataracts and see if the cataracts are growing in time to do surgery or not. So all this is done in the same visit.
So now when you checking the eyes, when your doctor's checking your eyes, he's looking into the back of your eye. Does he put a drop, or does he do something? Does he have special tools to look into the back of your eye? Just kind of Walk us through that
Right,
process.
sure. There are lots of drops, but none of them harm you. So what happens is the iris, which is the colored part of the eye, we have to open that up in order to look inside. And we have special instruments, lights on our head, things like that. That could look kind of scary or scientific or sci-fi like. But all they do is help us get a good view of what's going on inside your eye. So we give you drops to open up your iris, so it's wide open, so we have a clear view inside to the back to the retina. Usually the drops wear off in about 2-3 hours. So you walk around a little bit hazy for 2-3 hours. We always say take some sunglasses to your eye doctor so you can put them on and the sun won't bother you so much.
And you shouldn't drive after that. You should kind of take it easy. Someone that should be there to take you home, and
That's
you kind of
best,
take
yes.
it easy for a few hours,
Just
and
a
then
few hours.
your eyesight comes back to
Right.
normal.
People don't believe it, but it does. It comes right back to normal in about 2-3 hours.
Now, nutrition. We talked about general health. Does nutrition impact a person's visual health? You know, as a child, or at least where I grew up and where most of maybe some of our audience grew up, our parents told us things like, eat your carrots, you'll have pretty eyes, and it's good for your eyesight. Look at a rabbit, he has such beautiful eyes. You know, I don't know how they knew that, but, you know, could you tell us,
Sure.
is that a myth or is that any
No,
truth
carrots
to it?
are great, but don't stop at carrots. It's really about eating your vegetables, especially green vegetables, really can affect not only the eye, but it affects your whole body. So good nutrition and a good diet will make your body healthy, and in turn, that'll make your eyes healthy. Diabetes, hypertension, all of that can be held off if you have a better diet, one with green vegetables. And there's a specific disease, for example, called age-related macular degeneration, and that's a degeneration of the retina. It is the #1 cause of blindness in the elderly. So one of the things we know that can prevent that, if you don't want to use drugs, because we have a number of drugs and injections we can give your eye to help, not prevent it, but to help it from getting worse. But to help prevent it is to eat your green vegetables and make that a bigger and bigger part of your diet.
So now vegetables, as we all are hearing, is a good part of, a good thing to do for our eyesight as well as the rest of our body. So what I'm hearing you say is that just eating the vegetables not only help us, for some of us, lose weight. We eat more vegetables because we want to be slimmer, but it's also good for the eyes.
It's good for the eye, and one thing is people sometimes think that you can get nutrition in a pill, like taking a vitamin form, but it's not true. There's no way a pill can mimic what a vegetable can give you. So eat your green vegetables and you'll be much healthier, your whole body, not just your eyes.
Now, you've shared a lot of information today with us about the eyes, and thank you for keeping us informed. I've been very informed. And can you summarize for us quickly the importance of getting your eyes checked?
Sure. As I said before, children get their eyes checked every time they go to the doctor or go to school. But as you become an adult, you'll start seeing if you have visual problems, go to the eye doctor. If you have problems with reading, usually after age 40, make sure you go to the doctor. If you're elderly, you have to worry about glaucoma, cataracts, as well as if you have diabetes and high blood pressure, go to the doctor. Now, but if you have sudden loss of vision or sudden pains in your eyes, those could be emergencies, so I would go right away to the doctor. A lot of times your insurance may not allow you to go directly to an eye doctor, so make sure you encourage your primary care provider to send you to the doctor at least every year to check all these things out.
Thank you so much for the information that you've shared with us today. I have one more question before we go. Sometimes people sit in front of computer screens for a long time and their eyes get irritated. What's that all about?
Sure, that happens quite often as computers are part of our lives every day now. What happens with the computer is when you're staring at a computer screen, we don't blink as often as we normally do. And blinking is important to wash away your eye and to get the debris out and to lubricate. And if you don't do that, your eyes get dry. And so that's part of what we're feeling, is our eyes getting drier. So we tell people every hour or so to look away or walk away from your computer is one thing. You could also use artificial teardrops. Teardrops you buy in the drugstore that you put in your eyes that help lubricate your eye. The third thing is that sometimes people's vision actually gets cloudy as they look near. And as we're getting older and have the problem with seeing near, this is just part of that. Unfortunately, what we do at this point is we give glasses that have 3 levels of viewing. So one for far away, one for mid-range, which is what the computer is, and one for near, like reading a book. And you can have different glasses for different levels of viewing. So it's artificial tears, try that. And if that doesn't work, change the glasses.
Oh, thank you. Thank you for being with us today. And thank you for helping us to better understand our eyes and how to keep them healthy. To learn more about vision health, check out the Vision Health Initiative at www.cdc.gov/visionhealth. For more information on what eye health services are covered under Medicare, please visit or call 1-800-MEDICARE, which is 24 hours a day, 7 days a week. You can also get Medicaid information or children's health information by visiting www.medicaid.gov. Many of you may be interested in learning more about what new health insurance will be in January 2014. Stay informed about how you'll be able to start shopping for coverage this fall by going to www.healthcare.gov. You can sign up on the website for updates or your cell phone or through the mail, so you'll know what to do in order to get coverage then. Until next time, thank you and be well.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that fits you with low cost and even 0 premium plans for those whose income qualifies. If you or your family are uninsured or just looking for better coverage, you can see your options all in one place with one application. It's a place to compare a wide range of quality health insurance plans, to review them all side by side, and choose the one that's right for you. You'll find the information clear and easy to understand. You'll explore the marketplace at your own pace. You can compare prices and benefits, see an explanation of what a premium is, and what a plan will cost you every month before you make a choice. And every plan will cover you with comprehensive benefits, from your visits to the doctor or the hospital to your prescriptions, to screenings for cancer and other conditions. And no plan can turn you away even if you already have an illness or condition. The Health Insurance Marketplace, part of the healthcare law, opening October 1st. You can learn more right here, right now, and be ready for the new world of health insurance shopping.